Hello, folks. This is Dr. Mark Manhart. I want to just sit and talk with you just a little while about periodontal disease. It's a very common disease, and it gets into your mouth and it forms a colony up in the bone, the maxilla, right up there, and it forms a canal that goes down into the mouth, right in the palate. It's called a fat pad. And then the disease, so many times we take x-rays and we see it so often that there's nothing there. And we miss it so often because there's nothing there. Well, we even hide it when you do panoramic x-rays. Panoramic x-rays. And I got a couple of radiologists to decide what you do with this x-rays. And so dentists say nothing. Radiologists say nothing. I'll say, look at the bone. Yeah. And so radiologists look at the bone and, oh my gosh, there's a big here, that's infection. That's infection. That's infection. Yeah. Dentists treat radiologists to read those x-rays the way that they, nothing's there. Think of it in the bone. And this is it forms a colony of anaerobic bacteria. And there's three really important ones. There's actinomycosis, fusobacteria, and C. difficile. Those are three really bad things that you shouldn't use in the body or be there. Well, it's here, and it goes down through the bone, and the fat pad is there, and it goes in the mouth, and then down the throat, through the whole GI tract, and all the way down to the rectum. Now, there's hardly any oxygen in the rectum, so these anaerobic bacteria like oxygen. Oh no, they don't like it at all. And it's where there is no oxygen in the rectum, and so they get the colony. And before you know it, you have one up here and one way down at the rectum. No colony. I mean, no oxygen. There's research you've been doing it a long time. It's like 50 years. And I started out in school at Creighton, and it was just things that happen. I looked at some research for Roberto Holland down in Brazil. And he had a team of dentists with research. And there have been so much research. There have been Sweden research and English research and Japanese research and Turkey research about, and a whole team about calcium and zinc. Now, what's important here is if you have something that's really good here, calcium, really good here, they're nice. I mean, they're great. They're great minerals that the body has to have. Well, in the word that gets, it really tells us what to do. Not calcium, disease, zinc. You take those two together and you put it together in consilience, and it gets better. It works. Stick them together, and it gets better than the other than anything. And so we've done this for so long with the calcium method, and we have no surgery. It's called periodontal surgery. No, it's periodontitis. We don't have any surgery. And it's been safe to use and fast, and there is no pain to it, and it's cost effective and easy, especially when you have this sense of consilience. Okay, you know, Creighton, when I was in school, it has a very good hands-on education. And that's what really works, is hands-on. When you've got something that isn't working, put it together. And so we save teeth. Patients love it. And dentists doing cases of calcium therapy is easy. So get on Zoom if you want and learn something